Good morning, everyone. Today I am here to discuss the general principle of mental health nursing with you. First is introduction. The principles are general in nature and they are like form of guideline for providing emotional care to the patient, and nurse should have these principles while taking care of the patient who is suffering from mental illnesses. First is patient is accepted exactly as he is. It means that the nurse has to accept the patient without just showing any judgmental attitude, and the nurse should be able to convey to the patient that she may not approve everything what he does, but he will not be judged or rejected because of his or her behavior. Here are following way we show acceptance of the patient. First, being non-judgmental and non-punitive. Being sincerely interested in patient, recognize and reflect on the feeling which the patient may express, talking with purpose, listening, and permitting patient to express his or her strongly held feelings. First is being non-judgmental and non-punitive. Here, the patient behavior is not judged at he is right, wrong, good, or bad. Patient is also not punished for undesirable behavior, all direct or indirect, like chaining, restaining, or putting him in separated room or withdrawing attention. This method of punishment must be avoided while providing care to the individual. A nurse should show acceptance and does not reject the patient even when he behaves contrary or opposite behavior toward nurse expectations. Next is being sincerely interested in patient. The nurse must be sincerely interested in patient and considering individual interest and his need. On the basis of that, care and services is provided by the nurse to the individual, and sincere interest can be demonstrated by studying patient behavior pattern, allowing patient to make his own choices and decision as far as possible, being aware of patient likes and dislikes, be honest with him, taking time and energy to listen what he is saying, and nurse must avoid the sensitive subject and issues. Next is recognizing and reflecting on feelings which patient may express. When the patient talk, it is not the content to write or note it down, but it is the feeling behind the conversation, and the nurse must have to recognize that feeling and reflect that feeling. Next is talking with purpose. The conversation is based on the patient needs, wants, and interest. The conversation never be purposeless, and in conversation it is indirect approach, like reflecting open-ended question is asked from the patient and focusing on the point or presenting reality more effectively, avoiding evaluation or while talking with the patient and help the patient to explore his whole feelings. Next is listening. Listening is like active process, or it is very much necessary. The nurse should take time and energy to listen what the patient is saying, and she must be sympathetic listener and show a genuine interest toward the talk of the patient. Next, permitting patient to express a strongly held feeling. Here, some strongly held feeling due to which the problem is arised in the client, the nurse must permit the client to express a strongly held feeling without disapproval or punishing him. The patient may express his negative feeling like anger, fear, hostile, and nurse may encourage in verbal and symbolic manner. Nurse may accept the expression of the patient or strongly negative feeling quietly and calmly. Next, second point is use self-understanding as a therapeutic tool. Here, the nurse should use her self-understanding as a tool for assessing the patient's strength, weaknesses, and limitation. A psychiatry nurse should have a realistic self concept, then only she is able to recognize her own feeling, attitude, and responses. Her ability to be aware of herself, her strength, her weaknesses, her limitation, these things will help to see the strength and limitation of the other people or the clients also. And this self understanding help the nurse to be assertive in her life situation without being aggressive and feeling guilty. Next is consistency is used to contribute patient security. It means that the nurse or the staff who is providing care to the individual or the client, the attitude should be remain constant while providing routine care to the individual so that the patient feels secure while taking the care from that particular individual or nurse. Next is reassurance should be given in subtle and acceptable manners. It means that nurse should provide reassurance in an understandable and acceptable manner. Reassurance will help in building confidence in patient, and so the nurse should give reassurance in such a way so that client can understand and analyze the situation and helpful for dealing with problem also. If the nurse will provide false reassurance, it will lead to cause lack of interest of the individual and understanding or unwillingness. Next is unnecessary increase in patient's anxiety should be avoided. The nurse may follow few approaches while providing care to the individual, and therefore these things must be avoided. She should not have to show her own anxiety in front of patient, and she should not have to give attention toward the patient deficit. Make the patient to face repeated failure should be avoided. Placing demand on patient which the patient cannot able to meet should be avoided, and direct contradiction of patient psychotic idea should be avoided. Passing sharp comments and showing indifferent attitude toward the patient should be avoided. While avoiding these all things, unnecessarily increase in anxiety of the patient should be avoided. Next is objective observation of patient to understand his behavior. Here the nurse must have an ability to evaluate exactly what the patient want and what the patient want to say. Never mixed own feeling or own opinion or own judgment in patient wants. So the nurse should be objective and she must introspect herself, her emotion need, and do not over blame her needs over the patient needs. Next is maintain realistic nurse and patient relationship. Realistic and professional relationship focus on personal and emotional need of the patient, not on the nurse needs. So professional relationship should be maintained and able to sympathize and understand the feeling of patient and mean of behavior of the patient. Next is avoiding physical and verbal force as much as possible. It means that all the method of punishment must be avoided. The nurse must be an expert in predicting patient behavior. She can mostly prevent an onset of undesirable behavior of the client. Next is nursing care is centered on patient as a person, not on the control of symptom. Here the nurse must focus on care, focus on individual needs, not on individual symptom, as because two patients showing the same symptom but may experiencing two different needs. So the care must be based on the need of the patient, not on the basis of the symptom, or not to control the symptoms of the individual. Next is all explanation of procedures and other routines are given according to the patient level of understanding. Here, whenever the nurse is going to give any explanation to the patient, then that explanation should be according to the understanding level of the patient, and the explanation should never be withheld on the basis of psychiatric patient that he may not able to understand the things, or he is not having contact with reality, or he has not the ability to understand the things. These things must be kept aside, and the nurse basically give the explanation of all the procedures and routines whatever is carrying out on the patient. Next, many procedures are modified, but basic principles remain unaltered. According to this principle, in psychiatric nursing field, there are many methods adopted to individual need of the patient and understanding the scientific principle which must remain same. It simply means that the nursing principle must be kept in mind, like safety, comfort, privacy, and therapeutic effectiveness, economy of time, energy, and material. Procedures can be modified, but the principles may remain same. It should not be modified. This is all about the principles of mental health nursing, and these are total 12 in number, and this is like a very much important topic according to final examination point of view. And if you are having any doubt regarding this topic, you can ask me. Thank you and have a nice day.